Welcome to Getting Better with Dr. Adam. Dr. Adam Silberstein is a clinical psychologist who has been working in the field since 1993. With a broad range of clinical experience, including state psychiatric hospitals, adolescent residential treatment with a trauma focus, the Department of Corrections, and in the addiction treatment arena. Adam is currently in private practice and serves as a clinical consultant and supervisor for a number of treatment centers.
I just had a great time talking to Jolene Knight. She's a certified addictions counselor. She's the executive director and co-founder of Grace Recovery. It's a subacute and residential treatment program located here in Hollywood, California. This is what I want you to hear. I started the discussion off capturing a memory I had of her. We worked together many years ago, and it was a day patient type of program, and she had an office, a regular size office, and it was packed to the gill, and everybody wanted to be, all the clients, all the patients wanted to be in her atmosphere. And it really left an impression on me. And it was totally contagious. There was this contagious investment and connection with the clients, and she created an atmosphere where everybody wanted to pursue recovery, and if you didn't, you were sort of drawn in. Our discussion centered around that memory and how she has cultivated an atmosphere like that in her own program, and what are the ingredients that she uses, which are humanity, treating people with dignity, and fostering a sense of connection and community and simplicity around that, and how to not get lost in a sea of language of evidence-based and best practices, but more to go back to the basics of community, connection, and respect to help people get better.
This podcast is for general information and entertainment purposes only. This should not be considered treatment advice, nor is it a substitute for an individual treatment plan. If you have questions or concerns about your individual situation, it is strongly recommended you consult a licensed professional to talk about things that are specific to you. If there is an emergency, it is strongly recommended you seek treatment at your nearest emergency room.
Today, I'm honored to have Jolene Knight. She's the executive director and co-founder of Grace Recovery, which is a subacute and residential treatment program located here in Hollywood, California. And she's been working in the field for years and years in a variety of treatment settings, ranging from adolescent to adult treatment. And I want to share a little bit for me why I've been pecking at you and hounding you to come in here. I've been after you for a long time to come in here and talk to me. And I'll tell you kind of what made an impression on me and why I thought it was important. Jolene is a certified addictions counselor. And if you've ever been in a rehab or treatment program for substance abuse setting, the counselor role often does a lot of the heavy lifting of guidance and mentorship to the clients at those facilities. And years ago, I was in one of them, and Jolene was the clinical operations director, sort of making sure that everything was running as it should, and that the treatment was being delivered. And I was working there. I was, doing some therapy work there and maybe some groups, I think. Mm-hmm. And I'll tell you what made an impression on me. And this sort of goes against, I don't know what to make of this in a sea of evidence-based treatment. I'll tell you the memory I have of you. The memory I have of you was we had a lot of people there, maybe 20, 30 clients at any given time. And I remember your office being packed to the gill, and everybody wanted to be in your office during break times. And there was something contagious about And it's not disturbing when I'm talking about, if you're listening, it wasn't a disturbing sort of becoming best friends and, hanging out with them and buying, like it wasn't the counselor who's buying people drugs. It wasn't the counselor who's doing special favors. It was a contagious atmosphere of recovery where literally every single person and the families wanted to be in your environment. And it made an impression on me. It made a big impression on me. And I want to talk about it. I want that to be the foundation of this discussion, in a sea of trying to figure out what's considered best practice and words like evidence-based treatment and all the things that we talk about to capture what it means to deliver good care, right, for someone who's struggling with addiction. I don't know if I can go back in time and say what could I take out of what I witnessed, right? What was I witnessing that allowed people to have such a good response and want those individuals who would pack in your room, which was so many. They wanted, at least at that time, they wanted to participate and they wanted to be in your environment. Do you remember that?
I do. And that was, I'm touched by what you said.
Yeah. So so the reason I wanted to talk to you in particular, right, is I want to unpack, in the spirit of what I do here, which is getting better with me, right? I wanted to understand and try to I wanted to explore, what is it that you do, right? What is it that you do in that role for nearly 3 decades that invites that sort of level of engagement? And what have you created, and what have you noticed over the years,
right,
in terms of who needs help and how help is delivered?
Well, I mean, I think first and foremost, it's connection and humanity and honesty. Because I've had the luxury, and it's a luxury of being able to see the evolution of the treatment programs and the treatment model of care for almost 30 years. I've seen, it at its best, and I've also seen it at its worst.
So hold on. So when you say treatment at its best, right? That's an opinion, and I know you well, so there's opinions.
I've got a lot of opinions.
There's definitely opinions. So, and I'm gonna come. So, when it's operating at its best, what are the ingredients?
I think that the ingredients are different for each person. So, I don't think there is a best practice. That is, again, opinion.
Right.
I think the beauty is that we have so many different options for people that are in need of treatment, whether it's an adolescent or an adult. That being said, what I've observed over the past probably 10, 15 years is an extraordinary level of complication, which has subsequently caused complication for families, complication for clients. And going back to what I had said originally, why did people flock to my office? Why was there that kind of contagious feel? Because really, people are looking for connection. People are looking to feel some sense of humanity, and people are looking to have somebody be honest with them.
So when you were young in the field and inspired and learning, right, and sort of soaking it in as a new provider, what type of I'm guessing you're going to say connection, but what did you notice early on that was inspiring to you?
It was
was uncomplicated.
So it was 1991. It was at Coldwater Canyon Hospital on an adolescent locked substance use disorder program. And what I saw was all of the counselors, all of the therapists had one office. And I observed the exact same thing that you observed with me. All of the adolescents would go into the office and they would all sit around, not their therapist, not their psychiatrist, but their counselor, who was able to have honest and frank conversations with them. So I wanted that. I didn't want to keep working as a tech. I wanted to have that experience. I wanted to be that person. Now, I'm not discounting that there was tremendous value in the therapeutic relationship, and everybody has a role and everybody has a lane that they need to stay in. But that was the thing that became infectious for me.
So the uncomplicated at a place like that on Coldwater Canyon, that was what they offered.
That was what they
Did
offered.
they offer more than that?
Not much.
Right. So I'm picturing a room, right, and just an atmosphere, not just one-to-one.
No,
right?
it was an atmosphere. It was a collective experience for everybody. And we're not talking about people that wanted to be in treatment. We're talking about adolescents that are forced there by their parents, forced there by legal, forced there by, any number of reasons that somehow or another, simply by making the connection, were able to settle into, for most of them, a 90-day treatment experience. Many of which left there and went on to work in the field, become therapists, become psychologists, become psychiatrists, because there was something about that simplicity. Now, somebody had asked me a while back, how are you going to deliver a treatment model without CBT, without DBT, without all of these different modalities? People are so complicated. And I thought about it for a minute, and the reality is that people aren't any more complicated today than they were 30 years ago. We've become more complicated. We as providers have become more complicated. We have found opportunities for financial resources. We've grabbed on to certain catchphrases, evidence-based, best practice, and those have been adopted as the gold standard of how to obtain successful outcomes. We still can't figure out how to obtain successful outcomes. We're still grasping at straws. We're still trying to figure out.
And changing the bar.
Right,
of what that even means. Successful is a very complicated discussion.
It's
That's complicated too.
That's complicated in and of itself. For some people, successful is medication-assisted treatment, long-term Suboxone use. For some people, success is smart recovery, being able to drink in moderation and not use their, identified drug of choice. For some people, it's long-term abstinence from all substances.
So I don't mind going here. Walk me through. So you have this experience that at the heart of it, the connection and humanity piece, the part of the group, right? Everybody's invited to join.
Right.
It's actually not a separate go talk to someone else. It's actually encouraged to be a part of,
Correct.
Of a community. And whatever issue you have, and I think that isolation is such a profound symptom. And isolation doesn't mean I sit in a room
That's
all
right.
alone. That's not I can be isolated in amongst 100 people.
That's right.
It's the ability to connect and be part of something.
Right.
A community that is so powerful.
Right.
And that's the ingredient that you saw. And so now
and continue to see.
Right. You continue to see as the primary ingredient. And probably something that gets lost in translation when you have all these other elements that you're talking about of, multi-diagnoses and addressing each one separately. At the core of everything, right, is this connection piece and this community feeling a part of. And from there, you can work with other things. And if that gets lost, things get very complicated. And so I'm interested in in terms of the evolution of the treatment field, and you've watched a time when I would imagine there weren't so many resources available.
Correct.
And now there's much more. How did it start to morph into something different? When did you notice it?
I want to say that it was probably mid to late 90s. All of a sudden, treatment models were, at the time, for substance use disorder, it was straightforward. There was not this idea that you had to unpack everything in 28 to 30 days. The idea was you've got this short amount of time. People need that amount of time for their brains to start to operate differently. People need that amount of time to have some sense of buy-in. The idea was back then, it wasn't about willingness. There was this idea that all you needed was an open window, which was very different, very different than how it started to kind of change and evolve. Well, you have to be willing to do X, Y, and Z.
So you're saying you're attracted to a model that said, don't worry about willingness, worry about staying.
That's right.
And eventually you will find a window of opportunity.
That's right. And there was...
And it's not time pressured in the same way that it is today.
No. And there was also everybody kind of, at least, and I say everybody, the people that I engaged with during that time that were working in the treatment industry, there was not a notion, and I think you and I have talked about this in the past, back then clients didn't see a therapist until they had 30 days. They didn't even start to do therapy until they had 30 days, some of which didn't start to do it until they were discharged and it was part of their aftercare plan. Why? I'm not negating the value of therapy, but there was just kind of this standard that none of these people in their first 30 to 45 days of treatment are in an emotional place to be able to unpack some of their deep wounds that may or may not be the driving force of their substance use disorder. But it was really about, let's treat them with humanity, let's establish some sense of connection, and introduce them to community. And those three things were the magic recipe for people to be able to continue to stick around long enough to be willing to start to do the deeper work.
So treat them with dignity.
Mm-hmm. Humanity.
And humanity. Introduce them to community.
And connection.
Right. So simple. So simple.
And can't be taught. It has to be shown.
Say what you mean by that.
It's a feeling. I didn't walk around when you and I were working together saying, okay, everybody gather in my office for some community, humanity, and connection. It wouldn't have worked.
It's not a protocol. It's not a workbook. It's not a handout.
Sadly, it's not evidence-based.
Right. So, and this is the magic that I saw is how does one cultivate that as someone who's trying to help? How do you cultivate that? I want to get back to that. I also want to just focus on, so I come in that space and I'm unruly. I don't want to be here.
My favorite.
Fuck you, right?
Uh-huh.
Fuck you and your ideas
Mm-hmm.
and your kumbaya, whatever.
Right.
Of community, whatever your humanity and dignity. And
Mm-hmm.
I don't, right? So you're talking about being caring, but I know you're not a wuss.
I'm not a wuss.
You're not a wuss and you're not going to take nonsense.
Right.
So how do you demonstrate care and concern with someone who's, and treating with somebody with the humanity and a dignity who doesn't want to be there? You're saying, welcome.
Right.
Welcome. You don't want to be there, don't worry about it.
That's right.
You don't have to want to be here.
That's right.
You don't have to want to be here at all.
Right.
As a matter of fact, you are welcome one, come all.
That's right.
So how do you demonstrate that care and concern in the face of someone who is angry at you because you're sort of, you hold hold a certain amount of power and they may have to do certain things, and your pen right may influence how long they need to be here if it's a court order or something like that. How do you maintain that dignity?
Well, I mean, I think that there's a couple sides to it. One, those are my favorite clients, as you well know. But they're my favorite clients because sometimes they're the realest clients that we get. The ones that come in and they acquiesce and, they're super excited to be there and can't wait to dig in and do the work. Those are the ones that I worry about. The ones that wear it on their sleeve and are transparent about being pissed off and telling everybody to fuck off gives you something to work with.
So how do those people know you care?
I think being truthful. Being truthful. The beauty is that it's never been important for me to have people like me as much as it is for me to put my head down at night and know that I didn't leave any rock unturned. I'd rather tell somebody that they're a lying asshole
Yes.
than ask them to, sit down and write a feelings journal and share it with me.
So even the toughest, we were just talking, Jolene has had, different combinations of both female, male, and all, any combination of adolescents, adults,
Right.
Diverse populations, people from all walks of life, all sexual orientations, all gender assignments, right? Right. And there's a consistency there that you've had all male, all female, and
Right.
and you're not afraid to confront. You're not afraid to confront, and you feel it's your obligation to, if you speak your truth to me,
Right.
I'm going to speak my truth to you. And within that, there's a power and a connection and a respect, even with some of the most, I would imagine, the individuals you've worked with are considered some of the most difficult people on the planet.
Sure. Sure.
Right, on the planet. These are not, if we look at, just to give the audience a sense of what this is, if we look at their report cards, it's not just if only they would apply themselves, they do well.
Right.
It's they're disruptive, right? They bring the atmosphere down.
Right.
Right? They'll use words like
toxic.
toxic.
That's right.
They
Toxic.
are toxify environments.
Right.
They toxify relationships, right? And somehow through your ability to be real with them, and that's what you're not going to go to sleep at night knowing that you accommodated and just sort of didn't say what needed to be said.
Right.
That's the thing, perhaps, that is allowing for the respect and the dignity.
But that is humanity. That it and by nature of that, it creates community. Even if it's community between two people, knowing what you're going to get, knowing that there's no hidden agenda. I remember, going into therapy sessions personally and consistently trying to figure out, what is your hidden agenda? What are you trying to get me to get to? Where are we going with this? And not feeling connected, but rather feeling this, internal dialogue of, what's the end game? What's the end game? My experience has been that if you just lay it out there, this is my intention. My intention is to help you have a space where you can be angry and frustrated and not want to be here, and that's okay. Then they're not sitting there trying to figure out what the agenda is.
Because you've laid it out.
Because you've laid it out. You've laid it out. And then what happens is, because I was thinking about it, because I love having people around. Because what ends up happening is, while they may all have flocked to my office or may, flock to the backyard if I'm sitting out back, what starts to happen is, just by proxy, the community starts to create their own experience, their own transparency, their own humanity, connection, and community. And then it becomes more and more contagious. There's a lot more power in that.
So they can witness in a community space the authenticity. And in a lot of the discussions I have, it comes down to authenticity, the authentic exchange, right?
Right.
No guardedness, right? No fighting,
right?
But gloves are off, right? I'm going to say what needs to be said.
What you see is what you get.
And I'm going to deliver it to you. And I think the art for me is the ability to deliver the information in an artistic way that doesn't explode and knows, like you're saying, I know for sure this is what I'm about. I know you don't want to be here. I like that. I know you don't want to be here. This is what I'm trying to do.
Right.
I want to give you a space. This is my intention. If you don't like it, I get it.
That's right.
Right? You don't have to like me. You don't have to like it.
That's right.
But that's my intention.
Right. And having that information going in creates space for a lot of movement.
So right now you own the co-founder, the executive director of your own center.
Yep.
So how does Jolene Knight translate into, you're only one person.
Sure.
So what has happened?
I have many avatars.
Right? What did you do? And one of the, and what do you do? How do you create that environment? And this is also interesting to me. What do you do if there's a provider in your space who doesn't flock to your position, who isn't a community connector, authentic type of person? Maybe they wouldn't work there.
They probably wouldn't work there.
Right.
You know, there is, before me and my business partner opened Grace, we really sat down and pained over what we were going to do.
There are 50,000 places within 5 miles.
Right. There are as many treatment providers that we know of as there are Starbucks. You can throw a stone and there's a Starbucks.
Right.
That's the same for treatment providers. So it was a little, daunting to really sit down and look at what do we do, as you had talked about, in kind of a climate of evidence-based and best practice.
It's how you get paid.
And how do you get paid?
Right.
And how do you get providers to buy in or professionals to buy into what you're doing? And ultimately what it came down to was getting back to basics. Getting back to the basics, not trying to reinvent the wheel, not trying to overcomplicate a system, but to really look at what I do well, which is that primary first step, catch your breath, take a shower, make your bed, connect, see hope in a community, because the work is going to come. So I don't by any means want to give the impression that I don't see the value in evidence-based treatment, that I don't see the value in best practices. I just don't really know what the best practice is. I don't know that it's a universal best practice.
Well, you do know this. You do know that you're going to get people, and I'm speculating, who have never connected and never truly felt a part of, even if on paper they look like they felt a part of.
That's right.
Right? So you know that you're getting 100% isolators in their own way, in their own world.
Right.
And the art of this is, how do I reach everybody?
Right.
And allow every single person who's in my center to feel a part of the community. Right?
Right.
So I have to, so the whole environment isn't, that's the environment. That's
That
the
is
back
the
to
environment.
basics.
That's the back to basics.
Right.
And
I want to say, for your sake, they're going to get the psychiatry appointment.
sure,
They're going to get the therapy appointment. They're going to get all that.
they're going to get all of that.
Right. But to you, and by the way, I'm a clinical psychologist, and I agree with you. At the heart of this is I have to show people I care, and I have to show people I'm honest, and I have to be transparent about my agenda. If that's not in the beginning of the story,
Right.
it's all complicated.
Right. And breaking it down to, if there are some programs, they're doing therapy sometimes 5 times a week, right? So those are 5 hours during a week. And maybe you're meeting with your psychiatrist twice a week and you're 7 hours in. So what happens in all of those other hours is about that community, is about the connection. There are certain practices. We're an electronic-free facility. Clients can't bring their cell phones.
To treatment at all.
At all.
There's no cell phone
No
time.
cell phones. People
Wow.
can't have their computers. Why? Because what didn't we have back in 1991? We didn't have cell phones. We had communication. We made eye contact. We lowered our guard enough to feel a sense of community and connection. So why would I invite something in that's going to go against a practice of connecting, a practice of community? So there are certain steps that we take in order to, accelerate the process of community, to accelerate the process of being able to connect. Because in all of those other hours, whether they're in groups or whether they're in, individuals, there is a need for people to learn how to re-engage in their worlds, to land. So in Opening Grace, it was about, let's provide people with an opportunity to stabilize.
So when I talk to people and I hear people sort of going through the the journey of picking the best treatment center.
Mm-hmm.
I have opinions too. I think a lot of it is window dressing.
Right.
Right. A lot of it is window dressing and buzzwords.
Sure.
And
buzz groups, buzz modalities.
Everybody knows what to put on a website.
Right.
Everybody knows
Sure.
you gotta what words you gotta use. And all that is great. All that is great. But this to me too, right, is the essence piece that you can't read about.
That's right.
And you don't, and if you're not informed, you just don't know this stuff. You don't know that the experience of engagement, of being a part of being in the one, just another person in the herd, in the mix, right? Which sounds so obvious,
Right.
but really, the people we work with don't get that. They've never been just one of many.
Right.
They've never they want to be more than, they feel less than. Some of them have played sports and they may have a sense of it.
Sure.
And if that's the case, their addiction has hijacked that part of them entirely.
That's right.
And it's just a very lonely business.
Mm-hmm.
So to land and to use those words, I can't emphasize enough the value of this intangible that you can't read about. What are you going to write? Like, we build community? What does that even mean?
What does it even mean?
What does it even mean for someone to have the experience of, when you're in my care, if I ever see somebody marginalize you, and I'm just curious because I know you're in strength, let's see you see some people who are residents of your facility doing a group sort of marginalizing somebody. What happens?
Oh, we sit down and have a very, very straightforward conversation about it.
Right. And in that straightforward conversation, what is said?
It depends.
Meaning, what is the message? What are you going to land? And by the way, this is the art, is how do I set a very firm boundary, and what is going to be said?
Well, it was interesting. I was thinking back to somebody that I had that was, let's just say, treating staff with an element of disregard that was not conducive to the community feel, right? Because where does community start? It starts by showing by example. That's why I said it happens by proxy. So showing by example is staff, right? Staff sitting at the dining room table, eating together, eating with the clients, creating that sense. So client had a difficult time seeing some of our resident advisors, who are really the foundation of every treatment program, in a way that was disrespectful, hurtful, and demeaning. And so we had a conversation around the perceptions of value and human worth, and how we, even in our substance use, can create hierarchies of human value and human worth, and lowering some of those ideas and starting to dismantle some of the ego, which goes along with every person that walks into treatment.
So these teachable moments, right,
are imperative.
Right. These teachable moments, by having everybody in the big room, not in the private office.
That's right.
Right. Are such material for change opportunities.
Right.
And everybody has to, I would imagine that part of the atmosphere that you've created is, this is the mission, not just for you, but for everybody who's there.
But for everybody. And it's a microcosm. It's a microcosm of the big world. I want there to be an ability to, my goal is to prepare people to have an open enough heart to continue to do the work. The work doesn't stop.
And when you say work, for people who don't know, what are you referring to? I'm a person who comes in there, I'm 23 years old, I have a heroin problem. What's the work?
So the work is long-term creation of community. What that looks like is different for everybody. From the 23-year-old, heroin abuser who dropped out of school and can't go home to live with their parents. It may be a long-term sober living environment that creates community for the 45-year-old, working adult with a family that doesn't have the ability to go to day patient or go to a sober living. It's going to be creating a community with what they have. That's why I said there is no one size fits all.
That I think it was called Rat Park? The idea that they studied the rats and that the more the rats that were in community, even if they were on the substance, did much better than the ones that were isolating.
Always.
So the foundation is always going to be about connection and community.
Right.
So I want to take so if I'm coming into your treatment center, at the core of everything is continuity of community,
right,
and not isolating. So I don't mind talking to you about this. What do you see out there that makes you just cringe?
So,
what do you see out there?
We don't have enough time. So there's what makes me cringe first and foremost is monetary decisions. I think that makes me cringe. Pop-up treatment centers, pop-up sober livings that are monopolizing on clients' vulnerabilities, families' vulnerabilities for financial gain and for no other reason. There's a gross financial exploitation that is taking place and seems to be increasing. Seeing providers, whether it's, case management services or, treatment centers that are taking advantage of families and clients that are in their most vulnerable state and creating an atmosphere that they are the answer to all of their problems and creating dependence on that as opposed to introducing a dependence on a community. That makes me cringe. Families having to navigate, and especially, we're based here in Los Angeles, an overly saturated industry. The flip side of that is I also appreciate having variety. I appreciate that. I appreciate the programs that stay in their lane and do what they do really well, whether it's eating disorder or true mental health and providing the mental health services, whether it's trauma work. There's tremendous value in that because I don't believe in a one size fits all, but I do believe that every client, whether they are trauma, primary mental health, eating disorder, if they are actively engaged in a substance use disorder, you have to address the substance use disorder before the real work can happen. So that's part of what makes me cringe. The other thing that makes me cringe is trying to pack it all in to meet all of the SEO trigger words. We're mental health, we're eating disorder, we're trauma-based, we're substance use disorder. We do it all. We get it all done, in just 30 days.
Right.
That's not the reality. You and I have both seen people in their first 30 days. Right. You're grateful when they can get up and put 2 pairs of matching shoes on and make it through a 50-minute group without having to get up 7 times because the discomfort of being in community is so much they want to crawl out of their skin.
So what I hear in that is that the integrity of the whatever system you're in, whatever facility, it starts at the top with what is your mission?
100%.
And if your mission is, and it's complicated because you have to stay alive, right? It's complicated. Sure. And as business owners, I would imagine, you're faced with some very hard decisions about, what does it mean to stay in your lane?
Right.
And what does it mean to do the right thing?
Right.
And I take it back to your original message. If someone is going to be 100% transparent with the agenda, there will be no mission. There will be no mission misunderstanding.
That's right.
There will be no misunderstanding. I am here to give you space. I believe that it's going to take you time.
Right.
I do not believe that I'm going to take you to the promised land
Nope.
in 30 days.
Nope.
I do. And if someone comes in and says, I like to tell people, just realize that you're walking into a space that has a very, very low success rate.
That's right.
So if you're being told that you are going to have we have anything above 20%, and even that's generous,
Right.
right? Whatever that means, success rate,
Right.
Be careful,
Right.
right? I've had people being told they were, we have an 87% success rate.
That's right.
In 30 days.
And the evidence to back it.
Right.
Well, anyone can aggregate a bunch of data and pull together success rates. What I tell people, and I had a client very, recently that just tickled me to no end. I told him, prior to coming in, this is not going to be neatly buttoned up with a yellow ribbon at the end of 30 days. You're going to be able to catch your breath, and then the real work is going to start. And so when he discharged, he tied a yellow ribbon around my handle. Because that is the truth. When I talk to families, I tell them, you are about to make a financial investment with absolutely no guarantees. This isn't like college. You're not going to walk away from this with a degree. You may walk away from this with little to nothing. Know that going in.
And you're going to speak to so many places, right? And if they're not telling you what I just told you,
right,
I'd be really, really cautious, right? This is really hard, and it's not going to be easy, and it's a long game.
Which is, families are trying to navigate what they've picked up along the way. I'll have families call me, do you do DBT, CBT, trauma-informed, and we'll run down a list of every website, right, that you ever come across. Because these are all of the things that I'm looking for. Well, and why are you looking for these things? And ultimately, at the end of the day, it's because they just want an answer. They just want some guarantee that they can put their heads down and go to sleep and not worry that their son, their daughter, their husband, their grandchild is going to die as a result of their substance use disorder. I feel a responsibility. Not everybody may agree with that. I feel a responsibility to be as honest with the families as I am with the clients. There is absolutely no guarantee. All that I can tell you is that in this length of time, we will do our best to create enough buy-in by community that they would be willing to continue to do the work.
So I would imagine that your vision of how long has your facility been open?
We've been open about 1.5 years now.
So if I look at the 5-year, 10-year vision, right, that even if someone is struggling, they'll still be part of
the community,
the original community.
That's right.
Right? And that you're looking after each other years afterwards.
Years afterwards, on both sides. On the sides of, we're 1 year in now. So now we're starting to get the calls. Hey, I'm coming up on 9 months. Just wanted to let you know.
Or the call that I'm struggling
Or the
again.
call that I've been relapsing. I didn't follow maybe the discharge plan. Kind of went my own way, and I'm struggling. And the invitation is always extended. Do you want to come and have a conversation?
So what's so important to hear for me in that, and if I'm a family member listening, is that it's not all pretty. And that if I do create community, right, the gravity of the struggle, even if there is struggle, will be different if I know I'm invited in the community, if I'm a part of.
Right, and that goes both ways. That goes for the clients and the families, So part of my family program is it's a drop-in group for family members forever once somebody is a client with us. Because the family struggle doesn't stop because the client goes into treatment. The family struggle gets more and more difficult to navigate. So creating that sense of community isn't just about the identified patient. It's about the full community and what their community looks like and how it translates.
So I really, really like it in terms of this whole piece of community and engagement. And that's the theme. It's the thread through everything. Can you take us to a scenario where you've just been a case that you could describe of a family or a client that just what blows you away?
Today, what blows me away?
What's an example of a situation a case that you've worked on where you were just like, I cannot believe what has happened. This individual has come so far. This family has come so far.
Oh, yeah. I mean, affluent, grew up in, Palisades. Opportunity, went completely hard left. Arrested, multiple felonies, facing 5 years in prison, straight out of jail. And this was a while ago. This isn't recent. And she had to be in treatment for a year. And I had the opportunity to go to court with her. And at one point, the judge had said, and when I tell you, like, she had blown up her life, there was nothing left. There was absolutely nothing left.
Every relationship gone.
Every relationship gone. Prison seemed like an easier, softer way than doing the work. Family was not aligned at all. Divorced parents. Finances were always at the root of the conversation. How much money she was costing, how much they had to invest. This girl went from, a walking, billboard for a one-stop gangster shop that couldn't even tolerate sitting in groups. I remember watching the community just rally to a first job, to seeing something that was just kind of magical. And I remember we went to court and the judge asked me what her next plan was. And I hadn't even given it thought. And I said, she's going to enroll at UCLA in the CADC program.
You did that on the spot?
On the spot.
Uh-huh.
And her head spun around because we hadn't discussed it.
Uh-huh.
And he wrote it into her court order. He wrote it into a condition of her program.
Uh-huh.
So I remember driving back, she looked at me and said, "What the fuck was that?
Uh-huh.
We never discussed this." I said, "Well, we have now." A couple weeks later, she enrolled at UCLA. And she's currently in her Master's of Social Work program at USC.
Wow.
Sober, relationship with her family, with her parents, engaged, community, all community. I get a lump in my throat when I think about it because she's just like, it's magic, right? I think that's my blow away because there's no other explanation other than the fact that she was treated with humility. She was treated with humanity. She had integrity as a result of taking certain steps. She experienced community and connection. There's no other explanation. She did the work, right? But the work happened over time, years. Things would show up. There's more work to be done. But the community carried her and created enough space for her to be able to do that.
Basic, simple ingredients that I'm hearing. Mm-hmm. So the magic wasn't that magical.
Mm-mm.
What I saw was going back to the moment where I'm reflecting on your office being packed to the gill. What I saw was, this is who I am. This is what you're getting. I'm going to treat you in a certain way no matter what. Even if you don't treat me that way, I'm going to treat you a certain way. Dignity and respect and humanity. And that's the connection and connection. That's what invited all that. And I would imagine that's what's the work you still do. And it's the atmosphere you have created that's your own is probably all about. So I love that. And I just thank you so much. It was very moving.
My pleasure.
That story. How do we reach you? What's your best contact information?
Sure. So my best contact is 310-499-3128. You can also reach me at Jolene, Joelene, at gracerecovery.com. Thanks, Dr.
Thank you so
Silberstein.
much for coming.
Appreciate you.
This podcast is for general information and entertainment purposes only. This should not be considered treatment advice, nor is it a substitute for an individual treatment plan. If you have questions or concerns about your individual situation, it is strongly recommended you consult a licensed professional to talk about things that are specific to you. If there is an emergency, it is strongly recommended you seek treatment at your nearest emergency room.